I think the surgical clinic represents the best of general and vascular surgery in Nashville.
General surgery is a bit unique as opposed to other areas of medicine in that we generally treat acute problems that are reversible. I like to think of general surgery as a doctor who is capable and prepared to take care of any surgical emergency of the abdomen that a patient presents with.
I think we all have something special that we bring to the table.
There have been quite a few changes, particularly in vascular surgery, since I've started. We used to open everybody up, do big operations. We're less and less invasive now and often accomplishing the same goals.
General surgery over the past few years, we've been able to do less invasive approaches. Even now with colon surgery, of course gallbladder, we've been doing that for many years, as well as the appendix. But now we're doing more colon surgery and upper GI work, lower GI work with laparoscopic and even robotic surgeries now.
Laparoscopic surgery has been sort of a big revolution over the last 20 years, and it initially started with us doing laparoscopic gallbladder surgery, laparoscopic appendectomy, and it's sort of evolved to more complex things such as ventral hernia repair, colon resections, and anti-reflux surgery.
So we're able to do much more with less as far as the operations go.
In addition to the technical challenges, there's really a tremendous personal challenge involved as well. These are hard issues to discuss with people. You have patients that when they come in to see you, their interaction with you is probably the most or one of the most important periods of their life.
I am always amazed at how strong people are when faced with a life-threatening or life-changing illness or disease. And you give them news that's probably the worst news they've heard in their life, on sometimes the worst day of their life, and you help them through these times, and most of the time we get them better, and it's a great feeling.
If I can alleviate their worry about that or actually make their time with their family or their meal times more enjoyable, or again allow them to sleep, that's something I find to be a huge win for me.
One of the things I'm most proud about in my particular practice is that patients tell me that I spend the time with them, and I do, because my philosophy is if they're well educated, it's going to be less anxiety, they're going to understand the process, they're not as scared, and so I put the time in with them. I think that's one of the benefits of coming here. There are other places that patients have gone and then come here and said they didn't get this personalized treatment that they get here.
It's a big group of surgeons, and I like the way we are very collegial. We work with one another when we have difficult cases. We confer with one another, and I feel like that allows us to deliver a very good high level of care to our patients.